area of their responsibility. Oversight of certain aspects of hospitals, for example, standards of equipment and theatres, rest with the HSE in consultation with the Irish Medicines Board. As I stated at the outset, this, and I would hope that other speakers would stick to speaking about the actual directive and the regulations. I repeat that I don't propose to accept the motion as proposed here this morning.
Senator van Turnhout.
Thank you for your look and welcome, Minister. Today we're being asked to annul Statutory Instrument 325 of 2012, which gives effect to the EU Directive on standards, quality and safety of human organs intended for transplantation. And we all know that Ireland was legally obliged to legislate under EU law to ensure that we have a common set of standards across the EU, and I think that's something we can all agree on. I signed the motion for recall last year, but I didn't sign it this year. I signed it last year because the statutory instrument was being brought in without consultation and debate. But since last year, I've participated in 2 Oireachtas debates on organ donation. As a member of the Joint Oireachtas Committee on Health and Children, we've had 2 hearings in preparation for the forthcoming legislation, the Human Tissue Bill, and we'll be continuing our work on this area in the autumn. On the 18th of April, we heard the personal experience in relation to organ donations, and we also heard from advocacy groups representing those affected by organ donations. On the 25th of April, we heard from medical professionals working at the coalface of organ donation and from hospitals around the country, and we also heard from the legal community. And I would have thought that this was an ideal opportunity for Senator Daly to raise the issues, or in his words, flaws, that bring us here today. At the hearing on the 18th of April, I actually raised the absence of primary legislation in Ireland, and I noted that we only had the statutory instrument to introduce the European directive requirements. But I also would like to add that I've argued inside and outside of this chamber that too often Ireland gold plates EU directives when we should be dealing with issues in primary legislation. The EU directive deals with standards, quality and safety of human organs intended for transplantation. There is nothing in the EU directive to preclude Ireland from dealing with the issues raised in the lead up to today and the other issues which have not yet been aired when we deal with the Human Tissue Bill. And I've listened with interest to the debate on this issue in the lead up to today's discussion and believe that we're actually conflating and confusing the issues. One can almost feel the stampede to the high moral ground on this issue, when the reality is that everyone in this chamber would like to improve our resourcing and the operational issues in relation to organ donation. I was struck by the submission we received from the Irish Donor Network in advance of this debate, when it concluded by saying, "People are dying on the waiting list for transplantation in Ireland, but not because of the EU directive and its transposition into Irish law." And they go on to say, "To confuse the issue of EU regulation versus the issue of necessary infrastructure and national policy to improve transplant rates is to confuse the debate." End of quote. Surely the Human Tissues Bill is the appropriate place for us to deal with the consent arrangements for transplantation and research purposes, to deal with the establishment of a single body responsible for coordinating the drive to increase transplantation in the country, to put in place organ donation coordinators in every hospital, and to ensure we have an effective awareness-raising campaign in place. And they're just some of the priorities that I would set down. The proposal today is to annul the statutory instrument without, I might add, anything tabled as an alternative at this juncture. Is the legacy of today's recall to be the Seanad leaving a legal vacuum with respect to the quality and safety of the donor and recipient processes which the statutory instrument provides for? I'd like to stress my belief that the element purported by Senator Daly to render the statutory instrument flawed, a premise I do not support, should have been raised during the committee hearings on organ donation in April and can be dealt with in the development of the Human Tissue Bill. And for example, maybe I could advise the Oireachtas members at the Health Committee on the 19th of September we'll be considering the submitted recommendations on the introduction of an opt-out system of consent for organ donation. I signed the motion for recall last year, but not this year, and I believe I've clearly outlined my reasons. And actually, part of me wonders, it's almost as if Senator Daly is trying to invoke the memory of Bobby Hewing stepping out of the shower and forgetting that the past year has happened.
Gilroy.
Thank you, Gerlach. My good friend and colleague, Senator O'Brien, has said that this is a proper discussion, and the recall of the Senate has focused